Anybody out there have kids already? All right, some of this will be review for the rest of you. A lot of stuff I'm going to go through kind of step by step, mostly what you'll need for going to the hospital, for in the hospital, for going home, that kind of stuff. And at the end, if there are any questions that come up, please feel free to ask. So I'll go ahead and get started. First thing I want to talk about is choosing your pediatrician or your family physician. For those of you that are first-time parents, you won't already have somebody that you're taking your kids to unless you plan on bringing them to your family physician. And it's kind of hard to know how to go about picking somebody. The place usually to start, I think, is to ask family, friends, coworkers who they bring their kids to. Sometimes, location is an issue, whether you want somewhere close to home, somewhere close to the office. A lot of those things are places to get ideas of who you might want to take your child to once they're born. But beforehand, you can schedule a get-to-know-you visit with one of those doctors. I know through Children's, we offer a free get-to-know-you visit where you can go in and meet with the physician, talk to them about what kinds of things you want to see in your relationship with the physician, what kinds of things you're expecting, and then also find out how their office works, find out all those kinds of things. Certain things that you probably should ask about when you're at that visit would be, what are the office hours? What happens if something comes up outside of office hours? Do they have a triage service that you can call? Do they have urgent cares? Do they direct you to a specific ER or something if something were to go wrong after hours? You should find out what kind of practice it is. Is it a group practice where they share call with several other clinics in town? Do they just cover their own patients? What hospitals are they affiliated with? Will they actually be allowed to go see your newborn in the hospital, or do they have somebody else go see them there? Also, important to find out what their board certification and training are. You want to get somebody, obviously, who's as experienced and well-trained as possible for dealing with your precious newborn. Besides that, around the same time that you're choosing a pediatrician, you should probably start talking about choosing a daycare if you're going to be using a daycare. Sometimes there are waiting lists to worry about, so start early. Find out what age limits they are. Not all of them will take kids down to the newborn period. Usually 6 weeks is as soon as they'll start. You can go visit the site, do interviews, just like you would with the physician. Sometimes, the question is, do you want a center-based? Do you want an in-home? Do you want to do nanny services? And just like with picking your physician, a lot of it comes down to personal preference and what you want out of things. Some of the center-based daycares are, may have more educational services, whereas an in-home, it's smaller, they get more one-on-one time. So a lot of it really does come down to what you want to get out of it. Again, ask family and friends what their recommendations are. You may be looking for somewhere close to work, somewhere close to home, just like you would with your physician. Okay, what we're really here for. What do I need? You've got all those books out there that you're probably flipping through, and they recommend all kinds of different things, and you're walking through Babies R Us or Target and saying, okay, do I need this? Do I need that? These are the essentials, the things that you can't get by without. And number one is the car seat. You need to find one that is fitted appropriately for a newborn, that faces backwards, that has the 5-point harness, that's safety approved. And the hospitals are going to want to make sure that you have this before you go home. So that's definitely something that you need. Crib or a bassinet. Really, it depends on your housing situation as far as which one you are going to want to have. If you want to have the crib and then have the separate bassinet to have the child in the room with you for those first couple of months, some parents do make that option. Either way, you need to make sure that it's safe and that it has a firm, properly fitted mattress. The crib sets out there are really cute, and most of them contain bumpers, but bumpers are discouraged, at least according to the American Academy of Pediatrics, for their risk of suffocation along with SIDS. You'll want to have a fitted crib sheet. The dust ruffles are fine, but really it's the bumper part that we recommend against. Other necessities include your feeding supplies. This will depend on whether you're going to be breastfeeding or whether you're going to be bottle feeding. Also, whether or not you plan to be going back to work and needing to pump. There's several different models of breast pumps out there. Electric ones tend to work the best, and then a lot of it comes down to cost and portability and things like that beyond that. You'll need bottles and formula if you're going to be doing formula feeding. You'll need diapering and bathing supplies, your diapers, your wipes, your diaper cream. Deciding on a specific diaper brand, sometimes it really ends up coming down to what fits your baby the best. I had my friend just swore by Huggies, and so we went out and bought some Huggies, and as soon as we got my son home, put them in him, and they leaked everywhere for him. But for her, it fit her son the best, and they didn't leak anywhere. So sometimes it comes down to buying just small packs of them at first and seeing which ones fit better before you go out and get all the rest. The layette, that's your basic baby clothes, your onesies. A lot of that sometimes you get from your showers and things, but you do need to have a few basics ready to go. When it's time, the big days come, what do you need to bring to the hospital? All the baby books will have your lists of things. This is more the basics. Mom and dad supplies, your food, your cards, whatever you want to do to pass the time while you're in labor and waiting for the delivery. Don't forget your camera, and then also your cell phone. In this day and age, you'll want to have that by when it's time to call family and friends and let them know that you've actually had the baby. You'll need to bring your car seat to the hospital. Your outfits for pictures and for going home. During the day-to-day, oftentimes they'll put them in a little, looks like a little straight jacket, but it's a little wraparound shirt that they'll usually wear while they're there, but you'll want to definitely have an outfit for pictures and for going home. And then a lot of it depends on what time of year you're actually going to be delivering. In the winter, you'll want to bring your warm wraps and things to put on the car seat to keep them warm on the way home. In the spring, you won't need quite so much gear to take with you. Once you check into the hospital, all you need to do is give them the name of your baby's physician, and they'll call us. You won't have to make that call and let us know that the baby's been born. They do take care of that for you, so you don't have to worry about making that phone call at least. When the baby's born, it really depends on the hospital as far as how quickly they get the baby back to you, and also the situation of what's going on, whether it ends up being C-section, if there are any difficulties. Sometimes they'll have to keep the baby away for longer, but definitely they'll make an initial assessment of the baby, assign what's called the APGAR score, which is kind of just more a traditional thing that they do. They look at the baby, see how they're breathing, see how their color is, see how their tone is, and they assign them at least 2 scores at a minute of age and at 5 minutes of age, just to make sure that they're coming out and doing okay. In some hospitals, the nurses will actually do a gestational age exam to make sure that their physical exam matches up with your dates, to make sure that there aren't other things that you have to worry about, because premature babies and post-term babies sometimes have a little bit more trouble than the ones that are born on their exact due date. The nurses will do a few other things, what they like to call eyes and thighs. All babies will get special medicine in their eyes to protect them against infection during that first hour. They'll also get a shot of vitamin K to keep them from having bleeding troubles after birth. Hepatitis B oftentimes is given shortly after birth. That's the only vaccine that they end up getting in the nursery. And dependent on the situation and mom's antibody levels and things, that might be done within the first few hours of life. At about an hour of age, they'll check your baby's blood sugar. If it's low, then they may do a few more checks, or if the baby's large or small for gestational age. But again, that's just kind of normal transitional things that they're following up on as the baby comes out. Hearing and newborn screening are usually done after about 24 hours of life. Sometimes they'll do the hearing screen within that first 24 hours. If they refer on it the first time and don't quite pass, they'll often repeat it before they go home. Sometimes they have a little extra fluid built up in their ears, so if they do it too early, sometimes they have to redo it before they go home. Newborn screening is done at least 24 hours of age. They'll take a little blood sample from the heel to check that. And at most hospitals, you have the option of doing just the basic state screen or a supplemental screen, which goes through a lot more extra inborn errors of metabolism, which are processing and storage problems with blood sugar and things that can cause troubles later in life. The nurses will, at every time they peek at the baby and check their vital signs, will do an assessment of their skin color for jaundice. Jaundice is a very normal part of being born. It comes from babies are born with too much blood on board, and they have to break that down to get down to a normal hemoglobin level. As they do, they build up the byproducts in their blood and they turn yellow. That's jaundice. We worry about it because besides building up in the skin, it can build up in the brain. So the nurses are really careful to watch and make sure that they're not getting too yellow from that. They may do a little skin check. Some of the hospitals have a little actual meter that they can check jaundice levels without doing a poke. If that level is high, then they'll oftentimes then go and do another heel poke to check for the blood levels associated with the jaundice. Your doctor will come in within 24 hours of the baby being born. Depending on the time of day, it's usually the next morning, unless you happen, God forbid, but if you happen to deliver at like 2 in the morning, they'll usually be in that same morning. But other than that, with office hours, they tend to come in the next day. And they will do a head-to-toe assessment, make sure that heart sounds good, lungs sound good, they don't see anything physically wrong with the baby. They'll also do jaundice checks as well, and they will be in once a day while you guys are in the hospital to make sure that the baby's still doing okay before you go home. When you're in the hospital, you'll be making a decision, or probably have made the decision ahead of time as far as feeding is concerned. It does come down to personal choice. The American Academy of Pediatrics does recommend breastfeeding, but for some people it doesn't end up working out. So then you come up with the question, well, what formula do I use if I'm going to formula feed? Really, it doesn't matter unless there's a family history of food allergies, of cow's milk problems, of soy problems. If there's no history of that, then we just recommend starting with the plain basic Enfamil or Similac or store brand formulas. They're all really good these days, and they're always trying to improve and add more things to them. But when it comes to breastfeeding, all of the hospitals should have lactation specialists there, who are nurses who are specially trained to help you learn to breastfeed, help you with questions about it and things. And I really recommend getting in touch with them while you're in the hospital and utilizing their services, because I think they are great. Milk doesn't usually come in until the 3rd or 4th day, so it can get frustrating while you're in the hospital and trying to learn how to breastfeed. Sometimes you get so frustrated with it that you think, okay, do I need to give him a supplement? Am I a bad person if I do? Is my milk going to come in if I give him a supplement? You can always talk about that with both the lactation specialists and with your physician. Sometimes we will recommend doing a little bit of supplementation if the baby's weight has dropped too low, if they're having troubles with jaundice, because it does help out with both of those. But overall, we like to let moms work on breastfeeding and do that as much as they can. With those of you who are having boys, you'll have to face the decision of whether or not to circumcise. Really, it comes down to, again, personal choice. The decision is yours. In most cases, it's more a cultural decision than anything. There are some health advantages to it, which you can discuss with your physician, or we can talk about later. But overall, it does come down to a personal choice. Either the OB, the pediatrician, or the family physician should be trained to be able to do it. And make sure when you're at your get to know you visit, you ask your physician whether they do it or not, or if they refer it to the OBs to have it done. Afterwards, surprisingly, Tylenol is about all the babies need for pain control afterwards. They do numb them up during the procedure, and then they can have some Tylenol for that first 24 hours afterwards. You want to cleanse the area really gently, use Vaseline to keep the diaper from sticking. And then expect some swelling. It'll look kind of angry for a little while. And a little bit of a yellow colored film is normal. But if you had any questions about it, always feel free to give somebody a call and have them take a peek. Some physicians will use the Plastibell method, which is, it's a little more work for parents to have to deal with because they place this plastic device on there with a string, and then it allows the foreskin to fall off without making surgical incision. And they actually send you guys home with that device in place. So there will be special instructions involved if your physician does use that method. And generally that Plastibell should fall off within 5 to 7 days, and if it doesn't, they definitely need to be seen by a physician. When you're in the hospital, some people will want to go home right away. Some people will want to stay forever. Either way, the insurance company almost always pretty much dictates when you get to go home as far as the far end of things. With a vaginal delivery, they usually only give you 2 to 3 days. C-section, they add an extra day to that, 3 to 4. And that's for mom's healing, not necessarily for baby's healing. Your pediatrician generally wants to have a baby in for at least 36 to 48 hours because there are a lot of things that happen in the body with that transition from in utero life to out in the real world. The heart's changing its circulation, the lungs are changing. They're at higher risk for infection in those first couple of days. So your pediatrician will generally recommend that you stay for that, at least that full 2 days in the beginning. Some physicians will offer you home health visits where they'd have a nurse come out and do some weight checks and things. If they offer it, I'd accept it because I think that they're a great service. They can offer some support to you at home that you might not have otherwise, and they can answer questions and things too. First office visit for breastfed babies especially is usually within 1 to 2 days of discharge, and that's for jaundice reasons. Breastfed babies are at higher risk for jaundice than formula-fed babies because they have to wait that 3 to 4 days for the milk to come in. And that office visit usually consists of a weight check, checking how their skin color looks. If they need to, they may do a blood test to check for the blood levels of the jaundice. And to discuss feeding issues and go over any questions or concerns that you may have. If everything's looking okay at that visit, then they'll have you come back at 1 to 2 weeks for that first regular healthcare maintenance visit. They'll do a full physical exam, make sure that the baby's back to birth weight. Babies normally can lose up to 10% of their birth weight in the first few days of life, and then they slowly regain it over the first couple of weeks. So we want to make sure they are back to birth weight at that 2-week visit. If the baby was breech inside, sometimes they'll order a hip ultrasound at that 2-week visit to make sure that the hips have developed appropriately. Breech babies are a little more risk for having hip problems later on if it's not caught. Immunizations don't start until 2 months other than that hepatitis B that they give in the hospital. Some offices will do a 1-month visit. Most often, though, they'll have you wait until that 2-month visit to come in for your next regularly scheduled well visit. Obviously, you can bring your child in sooner if there are any concerns at all before then. And the concerning signs are these. Babies are at risk for infection during those first few months of life because they haven't been immunized, because their immune systems aren't fully developed. Breastfed babies will get some immune support from mom's breast milk, but they definitely are at higher risk for infection than older kiddos. So you want to make sure that everybody who's around is washing their hands. I do like the hand sanitizer that you can clip right onto the baby carrier, because then that reminds people to wash and use that before they touch the baby. But babies really will act differently than older kids when they're sick. They may not wake to feed. They may be very difficult to arouse when it's time to feed. They can be the opposite, just inconsolably fussy. They can run fevers, but sometimes they'll actually get cold instead of running fevers. And if they have this low temperature, you want to try to bundle them up and see if it comes back up with just bundling. But if it doesn't, then they'd need to be seen. The fontanelle is that soft spot on the top of the head. If that's bulging, definitely the child needs to be seen because then you worry about infection around the brain or extra fluid in there. But all these signs are signs to bring your child in and have somebody evaluate. Feeding. Breast milk, usually they'll feed every 2 to 3 hours. Formula every 3 to 4, and that's because breast milk empties out of the stomach a little bit more quickly than the formula. And we want them feeding on about this schedule pretty consistently for those first few weeks of life. After the first 2 to 3 weeks, it's okay to let them lengthen out a little bit at night, maybe up to every 4 to 5 hours. To let you guys get some sleep. But really during those first couple of weeks especially, we want to make sure they're feeding this often to get them back to birth weight and to help them flush out any jaundice that they may have troubles with. Back when I wrote this presentation last year when I first gave it, there was a lot of concern over bisphenol A in bottles. I know that they've taken that out of a lot of them. The jury's still out as far as whether it's truly an issue or not. The FDA really hasn't come out with any new recommendations in the past year about it. But if it is something that concerns you, there are bottles that are made without bisphenol A. That's the specific type of plastic, and there were concerns about it leaking out. And there's tons of things available. As far as what specific type of bottle you need, every child's different as far as which ones they will take better than others. There are different shapes of bottles, different shapes of nipples, and sometimes you have to play around with it to find one that the baby will take well. But you want to start out with a slow flow nipple, and that's because it mimics breastfeeding the most. Really, if you give them a bottle versus breastfeeding, they're going to get more out of the bottle than out of breastfeeding because it comes out faster. So choosing that slow flow option in those first couple of months of life is what you're going to want to start with. When they're feeding, babies will often spit. We're okay with it as long as they're happy with it, as long as they're not having pain, as long as they're gaining weight well. Those kids we call happy spitters. And ways to help out with that is to avoid overfeeding. If you're bottle feeding, stopping to burp every half an ounce to an ounce, keeping them upright. If you're breastfeeding, making sure that you're keeping them upright for 15 minutes or so after breastfeeding and burping them well will help out. Sometimes you can actually take their bassinet or their crib mattress and elevate it about 30 degrees by putting a flat pillow underneath the mattress if they're having troubles with spitting, and that can help. For whatever reason, tobacco smoke actually makes spitting worse, so keeping them away from that will help that as well. The symptoms that we worry about is if the spit becomes projectile, and what physicians mean by projectile is if it's actually shooting all the way across the room, not just landing on the floor next to your lap. If there's blood in it, if there's anything bright green in it, if they're not gaining weight, if they're just fussy all the time, uncomfortable, not wanting to eat, or if they're starting to have breathing problems with it. These are signs that something more serious may be going on. Is it an intolerance to something, whether it's something that mom's eating, whether it's the formula, is there something physically obstructing that's making them spit everything up? Those are the things that we would need to see a baby for. Pooping is another natural process. In those first couple of days of life, they'll have something called meconium. That's that really dark, sticky poop that is their first poop. It's actually sterile. There's no bacteria in it, but it still doesn't keep it from being gross. The nice thing about it is it doesn't stink like later baby poop does. But that's the poop that they'll pass during the first couple of days of life. As they start to feed better, as they start to grow better, that will transition over to more of a normal baby poop. And you guys won't believe me now, but after you become parents, you'll just become obsessed with the baby's poop and what it looks like from day to day. Because I don't know, you'll change it so often, and it changes, depending on what they've had to eat, that you really will become obsessed with the poop. For breastfed babies, it's usually kind of a mustard color and seedy. I had a parent ask me recently, now nobody's ever explained to me what exactly the seeds are in the poop, and actually it's curdled milk is what it is, so it's kind of like cottage cheese is what that comes from. They can be a little bit runny, and breastfed babies will usually poop like 8 to 10 times per day. In the first few days of life, while they're passing that meconium, we want them to poop at least once a day. Otherwise, jaundice doesn't work its way out. But after they start to turn into the regular stool, they will poop quite often. It may seem like every time you're changing a diaper, there's poop there. When they get a little bit older, closer to 2 months of age, some breastfed babies will only poop once a week. And that's when we start getting the phone calls from parents. As long as it's soft, as long as they're not uncomfortable with it, then it's a pretty normal thing. For formula-fed babies, their stools are a little bit more peanut buttery. They're a little more tan. They have fewer of them, and that's just because of the composition of the formula. Grunting is normal, but if they're having really hard stools, if they're having a hard time passing stools, if there's blood in it or mucus, then that's a problem and we'd need to see them. Sleeping, babies need to be on their back to sleep at all times, and that's for SIDS risk, which I'll discuss in a minute. When they first come out, they may have day-night confusion. That's very, very common, and it's not something you guys are doing. It's actually because moms tend to be more active during the day while they're pregnant, and their movement rocks the baby to sleep. So you guys may notice right now that the most active time of day for baby is when you lie down to go to sleep at night. That's when baby's kicking and moving and hiccuping. So when they come out, they have to get that turned back around again. And it may take the first couple of weeks for that to get turned back around. The best way to do that is keep them as close to that 2 to 3 hour or 3 to 4 hour schedule during the day as you can, because that gets them into that routine and helps them lengthen things out at night. Sometimes if they're not sleeping well, it may be because of feeding issues, if they're not getting enough, or if their tummies are hurting. So if it's really just a problem, then they might need to be seen by their doctor. You may hear a lot about colic. The true definition of colic is crying for more than 3 hours per day, starting at 3 weeks of age, lasting for more than 3 weeks, and it usually resolves around 3 months of age. So it's the rule of threes. Nobody really knows what causes it, but sometimes we need to decipher out, is it colic or is there something going on like acid reflux or formula intolerance or something that's giving them a tummy ache. So if there are any concerns, obviously give the office a call and talk through it, and they'll see if the baby needs to be seen. There are a lot of theories out there as far as what causes colic, and there are a lot of products out there that claim to help with it. Some people think, is it gas? We try gas drops and gripe water and all kinds of things. There's one theory out there that it's melatonin dysregulation from being born, and they have to get it all sorted back out before they just magically get better. We really don't know. To tell you the truth, I went out and bought like tons of different things to try to help out my son because he was a bad sleeper for the first 3 months of life. And I don't know if it ended up being any of the things that I bought, whether it was the vibrating thing for the crib mattress or the mobile, or if he just outgrew it with time. But there are lots of things out there that claim to help, and usually it is just time getting through it. SIDS is the sudden unexplained death of an infant younger than 1 year of age. That's the definition. It's the leading cause of death in infants between 1 month and 1 year of age. Before a month, it's usually more birth defects and infections and things, so it tends to be that 1 month to 1 year of age. And really most SIDS death happen, there's a second peak of it between 2 and 4 months of age. I think that's more because parents get more relaxed at that age and start letting them sleep on their tummies when they're not quite ready for it, so it's really important to keep them on their backs. In there again, nothing but the baby and the firm mattress with the crib sheet tucked in tight. There are those sleep positioners out there now, and they claim to help out with SIDS, but they haven't been truly studied by the American Academy of Pediatrics to approve them yet. The concern with them is that a lot of them are made out of foam, and so then they again pose the same kind of suffocation risk as you would with crib bumpers. So right now we don't recommend them. Also, smoking puts kids at more risk. Overheating, if they're too bundled, too warm, they can actually forget to breathe. Proximity is a good factor. They found that having baby close to you within the same room, so in the bassinet, but not co-sleeping in the bed, helps out with SIDS. Pacifiers, they really don't know why, but pacifiers have been shown to have a decreased incidence of SIDS. With those of you who are worried about breastfeeding and pacifiers, I haven't seen a whole lot of nipple confusion between pacifiers and breastfeeding, but some parents do like to wait until 2 weeks to introduce them. Home monitors and other products really haven't been shown to help. I think the crib monitors are nice to be able to hear the baby and to be able to know what's going on, but those ones that you put underneath the mattress that detect whether they're breathing or not, they really haven't shown to make any difference in actual SIDS. And then the other big thing is giving babies tummy time when they're awake, when you're there watching them. Having them lie on their tummy on a thin sheet on the floor so that they learn to lift their heads up and learn to move their heads to the side if they do happen to get themselves over onto their tummy on their own. We want them doing at least 5 to 10 minutes of tummy time a day, starting after about a week or 2 of age. Babies will make lots of noises. Some of them are cute, some of them are not so cute. As I mentioned before, grunting is normal. Other things that are normal that I didn't put on here: hiccups, sneezing. Those are very normal, and they end up actually annoying parents more than they annoy the baby. They outgrow that usually during the first couple of weeks of life. When babies are born, they still have a lot of fluid in the nasal passages and things that they have to work out, so that causes them to sneeze a lot. The hiccups, they really just end up having to work through with time. As far as crying goes, you can't spoil a baby in the first 3 months of life, so it's okay to pick them up and soothe them. And it really takes some time to decipher why the baby's crying. Are they hungry? Are they tired? Do they need a new diaper? Are they gassy? Or that they're just bored? And you may not believe it now, but over those first couple of months of your child's life, you'll start to learn the different cries that they have and be able to decipher which one they need at which time. There's a book out there by Harvey Karp that talks about how to soothe a fussy infant, and he postulates that babies are actually born too soon, that there's really this missing 4th trimester where they feel like they should still be in the womb when they're on the outside. And so doing things to mimic that actually help to soothe a fussy baby. And he has his 5 S's. That's swaddling, holding on their side or their stomach in your arm, shushing really loudly to mimic the sound of the womb, swinging back and forth, and then allowing them to suck on something, whether it's a pacifier or your finger. And doing all 5 of those things at the same time should magically make the baby better. If you Google it or YouTube it, I think there's videos of him doing this. Sometimes it works, sometimes it doesn't, but the biggest thing is we never shake a baby because that's when you end up with shaken baby syndrome, brain damage, seizures, death, those kinds of things. And again, back to the colic thing, if baby's just inconsolable, fussy all the time, sometimes it's worth getting that baby in to see their doctor because there could be a tummy ache or something else going on that they need to be seen for. Babies will make lots of movements. Some of them may seem kind of strange because when babies are born, all the neurons aren't completely connected, so some of their movements will be kind of jerky and erratic. They have normal reflexes that they outgrow over time. There's one called the Moro, where if you startle them, they just jump and shake. If you touch their face, they'll kind of root to the side looking for something to eat. If you touch their palms of their hands or the soles of their feet, they'll kind of grab on. Those are all reflexes. A couple of my favorites that I like to show parents at the 2-week visit are the stepping reflex. If you hold them, they'll actually look like they're walking, and they outgrow that one. I saw a special on Discovery recently where they found out that they actually outgrow that one, not because they outgrow the reflex, but because they get too heavy to hold themselves up for it. So they put an older baby in a fish tank of water, and that took away the weight with gravity, and they actually showed the baby walking along still with that. And then my other one that I really like is fencing, and that one, if you turn the baby's head to the side, they'll put one arm like this and one arm up like they're sword fighting. Babies will have crossed eyes quite often. That's because, again, neurons aren't completely connected. If it's happening, intermittently early on and they end up outgrowing it, then that's totally normal. If you find that they just have one that stays where it is and it's not going back to a normal position, then you should have somebody look at it and see if there's a visual problem there or something else going on. They are not very fluid in their movements. They'll often seem jerky, erratic, but things to worry about is if they're not moving one side, if they're having rhythmic movements, if they're extremely stiff, or if they're extremely floppy. Those are signs that there's something worrisome going on. Bathing. Baby will get their first bath in the hospital, and oftentimes that's the first thing you want to do when you get home. Really, babies only need to be bathed every other day or 2 to 3 times a week. Because their skin's really sensitive. They're transitioning from an aquatic environment in utero out to the dry air. So their skin will actually peel off and flake off. You can apply as much lotion as you want. That won't make it go away any sooner. But really, they just have very sensitive skin, so you don't need to bathe them more often than 2 to 3 times a week. You want to make sure your water heater is set to no more than 120 degrees. That's the safe limit to keep you from accidentally burning the baby. You'll want to do a sponge bath until the cord falls off, and then for those boys until the circumcision's healed up as well. And usually both of those are healed up by about that 2-week visit. Belly button care, they used to have you do alcohol wipes. Some doctors will still have you do things to it, but anymore, a lot of physicians are just recommending leave it alone, keep it clean and dry, and then just wait for it to fall off on its own. Belly buttons can get infected, so you'll want to watch for infection, which would be redness around the belly button, swelling, any green, gross, stinky drainage coming from it. Nails are really hard to trim. Babies are small. They move around a lot. So it's easiest during those first couple of weeks if you use a nail file like an emery board, or the nails are really soft. You can sometimes just grab a corner and tear it off. But you'll want to wait until they're a little bit bigger to actually go after them with the nail clippers. And personal experience, when you do it the first time, you probably will clip off a little end of the finger, and it grows back, and they do have fingerprints afterwards, and you'll probably cry more than they will, but it's very common for that to happen. I think we're getting towards the end of my slideshow. Babies, again, back to skin. Babies will have weird rashes at birth too. One of them, it's called erythema toxicum. It's a big, scary name, but it's really just a normal newborn rash. That's this one right here. It's kind of a red, bumpy. It actually is more prominent in kids that have more troubles with jaundice, and it goes away on its own. Baby acne usually starts at a couple of weeks of age, and it's from your maternal hormones working their way out of the baby. Can take a couple of months for it to go away. You don't want to scrub at it or put any ointments on it. Really, the best thing is to leave it alone. Milia, I don't know if you can see that picture very well. Those are just little white dots on babies' noses. They come from kind of blocked sebaceous little oil glands in the nose, and they go away on their own. Cradle cap is a pretty common concern. That's the flaky, dandruffy looking scalp that some babies get. They can get it on their ears, their eyebrows as well. That doesn't mean that they're going to have dandruff when they're older. It's just like the milia. It's blocked oil glands, and then it kind of flakes up and gets inflamed from that. Usually just taking some baby oil or some olive oil and rubbing that into the scalp, and then taking your soft baby brush to brush off the flakes prior to shampooing will help. If it's more severe than that, they can use some Head and Shoulders a couple times a week, but be careful with that one because you don't want to get it in their eyes compared to the baby shampoo. But if it becomes a concern, you can always talk to your doctor. Diaper rashes are pretty common. Most of them you can treat with just that regular either butt paste or Desitin or Balmex or A&D. Any of those diaper ointments really all work about the same. The one that oftentimes is that rash that won't go away is actually the yeast diaper rash, and that tends to be more in the creases. If you have a diaper rash that won't go away, give your doctor's office a call, and sometimes they'll have you describe it over the phone and see if it's something that needs to be seen or not. The yeasty diaper rashes will actually recommend over-the-counter Lotrimin for it usually. I think this is my last slide, and this is just kind of my hodgepodge of things that parents tend to worry about. About 1 in 20 babies will actually have blocked tear ducts. The big fancy name for it is there, but I don't expect you to remember it. It causes excessive tearing of the eye because with the blockage there, the tears don't flow down into the nose like they normally would. Sometimes they can have some yellow-green mattering, some crusting to the eyes. As long as there's no redness, swelling of the eye, redness to the white part of the eye, we usually just have you watch it. And it self-resolves by a year of age. Usually it's more around 6 to 9 months that it gets better. If it doesn't, then the ophthalmologist will take a peek at them at a year of age and actually go in and open that tear duct for them. What you can do in the meantime is take a warm, wet washcloth, massage the upper eyelid, and sometimes that helps work out the blockage on its own. Signs of infection are there: redness, swelling of the eyelids, excessive drainage. So if it's just gooping and gooping and gooping, if the drainage changes from what you're normally seeing to something more excessive, or if the baby seems to be having any sensitivity to light or anything else like that. I think that's all I've got. And we have plenty of time for questions if anybody has had any come up or anything that I didn't address.
How can you tell if your baby is allergic to the formula?
Formula allergies tend to be, there's something we call milk soy protein intolerance. About half the time kids that have troubles with cow's milk will have troubles with soy milk, so that's why they kind of lump them both together. Symptoms of formula allergy would be extreme fussiness, gassiness, acting like they're uncomfortable, arching their back. They can have changes in their stools, where their stools are really mucousy. Sometimes they'll actually have blood in their stools if they're having a severe intolerance to it. Some kids will have kind of eczema, dry skin rashes from it. So it kind of runs the gamut. But the biggest thing is the fussiness, acting uncomfortable, especially around feedings. And some kids will compensate for that. They don't understand that feeling of pain in their tummy. So if they're acting hungry all the time, they may be misinterpreting pain for hunger and wanting to feed all the time too. Good question. Yes?
How long does one breastfeed or transition from breastfeeding to the bottle? Should there be a period of time that you wait?
It really depends on your own situation as far as how long you want to breastfeed. We recommend doing it as long as you can. Sometimes the problem is going back to work and not wanting to have to do the pumping at work and things like that. That really comes into play. But we do recommend doing it as long as you can. There's really no age limit. One of my partners, she's got 6 kids, and she's currently trying to breastfeed her last one up to age 2. Some parents, 6 months is a good time period because then they are starting to build more of their own antibodies at that point in time. And some parents, they don't make it quite so long because of supply issues and things like that. With transitioning to the bottle, if you're going back to work, I think sometime a couple of weeks or so before you're going to go back to work, at least introducing a bottle, a feeding a day, to try to get them used to it and learning how to take it.
Well, can you do both? Can you pump and then do bottle and breastfeeding?
Yep. You can do both. Some people worry about nipple confusion. I don't see that all the time. I think it really ends up being if it works in your schedule or not. Pumping and then bottle feeding sometimes can be cumbersome as far as you have to pump and then put it in the bottle and then feed and things like that. But if it works for your schedule, then I think it's just fine to do that. And
you said it's common for 3 to 4 days the milk hasn't arrived, so you're not able to.
You still want to get the baby latched on, and actually latching the baby on every 2 to 3 hours will encourage the milk to come in sooner. And the babies are born with an extra 3 days worth of fluid on board. That's why they lose weight. So they're built to withstand that 3 to 4 days of waiting for the milk to come in. You may find that on that last day right before the milk comes in and the baby's at the bottom of their stores, they may want to cluster feed and feed every hour. It's very normal for that to happen. It's not anything with mom or with baby or anything like that. It's part of the normal process.
So they're not on a formula for those 3 to 4 days?
Nope, you want to still breastfeed them. If there are any concerns with weight loss, if they're losing too much weight or if they're getting more jaundice, sometimes we'll have parents supplement a little formula. But part of the natural process, we just have you latch them on and breastfeed. Yeah. Other questions?
How do you find out what the baby is allergic to?
Allergies are interesting. During the first year of life, it's mostly foods is what they end up being allergic to. They don't tend to develop seasonal allergies, pollens and grasses and things like that until they're over a year of age. When it comes down to formula intolerances, we'll often do trial and error. If you're living on the West Coast or the East Coast, they call it something different. They just call it cow's milk allergy, and they see it more the half glass full rather than the half glass empty. They'll often try doing soy formula first because half the babies won't be allergic to soy formula. In the Midwest, oftentimes physicians will jump a further step down to a more broken down formula, assuming that they may be allergic to soy, and see if they do better on something like that. So it ends up being trial and error. If kids are having severe problems with bad skin rashes or hives or things like that, sometimes we'll send them to the allergist and have them do some further testing.
Even with like medicines and stuff like that.
As far as
Like penicillin or any other
medicine allergies,
stuff
we
like
do kind of a wait and see approach. We hope that babies don't have to have antibiotics until a little bit later, and we usually start with the more basic ones like the amoxicillin, the penicillin class, and then if they have a reaction to it, then we say that's an allergy and don't do it anymore. Other questions? If there are any, oh, go ahead.
I do, I'm sorry, I have a couple more.
Yeah.
The shots and the immunization, I heard that was linked to autism. Do you see any ties or?
Currently, the jury's still out. There was that initial study several years ago about the MMR, specifically possibly being linked to autism. They thought it was due to a preservative called thimerosal that was in it that contains mercury. They took that out a long time ago, and they still haven't seen any changes in rates of autism. Within the past year, they went back and looked at the initial study that the gentleman had published that brought up the first concerns, and saw that the babies that he reported having problems afterwards, actually when they went back and looked at the charts, had some developmental concerns prior to receiving the immunizations. So there's not really a good cause-effect relationship put together right now, and unfortunately, the answer to that is we don't know what's causing autism, but they don't think it's the vaccines right now. As far as vaccination schedules go, and first year of life, you'll begin to see the doctor every 2 months or so, because babies come in at that first 1 to 2 days, 2 weeks, 2 months, 4 months, 6 months, then it goes to 9, 12, 15, 18, and 2 years before you start lengthening out a little bit. Good conversation to have with your physician at that get to know you visit, though, if you do have questions about vaccines, because some physicians are willing to do more delayed schedules if you have worries about it. Some physicians don't feel comfortable taking care of kiddos if you choose not to vaccinate. So definitely something to bring up if you do have those kinds of concerns. Yes.
Like, what about for the mother now with this N1H1 vaccination?
Don't know yet, and I'm still waiting for all the CDC information to come out. Where this is such a new thing, it's always been safe for pregnant women to get the flu shots, the regular flu shots, and actually recommended. But I think we need to be really careful as far as looking at the safety data on the new vaccines before they start giving them out. Good questions. Anyone else?
Is there a way to get your baby switched from night to day? How hard is that to do?
It can be a process, and it usually takes that first 2 to 3 weeks. But I think the best thing to do is try to keep them as close to that every 2 to 3 hours feeding during the day, and keeping them on that schedule during the day to allow them to then lengthen out at night. There was one book that I read that talked about doing a 2.5 to 3.5 hour schedule where you'd feed, have them awake for a little while, let them sleep, then wake them up and feed, and then have them awake for a little while, let them sleep, basically so they wouldn't nurse themselves to sleep. I don't think you necessarily have to be as stringent as that, especially during the first couple of weeks, but definitely trying to keep them feeding more often during the day, and then trying to keep nighttime awakenings with as little stimulation as possible. So not changing the diaper unless it's poopy, trying not to get them undressed and those kinds of things. Keeping the lights down at night will usually help them switch over. Yes.
You said that we should keep them upright after feeding, but oftentimes they fall asleep, like right after feeding.
Sure.
So
kind of trying to hold them more an upright angle for, it depends. If your baby doesn't have a lot of troubles with spitting, then the length of time isn't as much, but kind of trying to hold them more on an incline for a good 10 minutes or so to keep things running downhill.
Or like a little bouncy seat, it's okay. Or a swing that's kind of upright.
Yep.
Should they sleep on a wedge?
Currently not recommended because of the lack of data out there with them, and then there's concerns that the wedges that are out there currently are made of foam, so they may actually present a suffocation hazard. So not currently recommended, although I know there are a lot of them out there.
Yes. You mentioned that you're not supposed to use the bumper pads. I heard something about the blankets that come with it. Is that true too?
Yeah, really you want to try to keep as little in the crib as possible. If you're really good at swaddling and doing that burrito wrap, then it's okay to have them wrapped up in that. The sleep sacks are really nice because those do it for you. They have Velcro in them and it just swaddles them around. But we try to keep anything out of there that they can pull up around their face or get up around their face, stuffed animals, big soft blankets, things like that. Really, if you're comfortable in the room in a thin layer of clothing, they're going to be comfortable as well. Anyone else? Yes. If there are any questions that anybody has that they don't want to ask in front of the whole group, you can also come down and ask me too at the end here. Yes.
I have one more question. Is there like baby vitamins, like drops that you can give your newborn, or do you wait until a certain point in time?
Yep. There's one. There's off brands of it, but the one that we usually do for breastfed babies is something called polyvisol with iron, and it's the iron component of that we usually recommend. They're really gross and stinky, and they like to spit them out, and it stains the clothes. But usually we start that after the 2-week visit for breastfed babies because they don't get quite as much iron in their diet as the formula-fed babies do. The babies who are on formula, the formulas are made with all that already built in, so it's not necessary to give it to them. And we usually recommend, recommended dosing and things like that at your 2-week visit if there are any concerns.
Great, thank you.
No questions.
All right. Well, good luck, you guys, with everything, and congratulations in advance, and hopefully everything goes well.